Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah. Amma ba'd, assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Sending the Community with me, Hafiz Muhammad Umar. And in today's show, I am delighted to be joined by an amazing local person who does a fantastic job with an absolutely brilliant local um, organization. My guest today is Sandra Gouldbourne. Welcome to the show, Sandra.
Thank you, Mohammed. It's great to be here. And just to tell you a little bit about Healthwatch and how it was established.
Brilliant. Thank you so much for joining us, Sandra. We will talk in depth about Healthwatch Luton very, very shortly. Sandra is the Community Engagement Officer at Healthwatch Luton. Before we go back to Sandra, I just want to remind our listeners of all the other amazing events that are taking place locally. For those of you that are interested in disability cricket, you will know that the disability cricket season has concluded, but we will be moving indoors from next week. So please do watch this space for more information regarding our winter training program. Our outdoor training sessions at Luton Town Indians Cricket Club at Warden Park concluded last week. Alongside that, there's lots of other things happening locally. And if you want to be keeping up with what's happening around you, Autism Bedfordshire have a number of events going on at the moment, and there is also the Global ADHD Conference coming up later in October, and the RNIB have so much more going on for people with visual impairment as well. So please do continue to tune into our show each week as we try and raise profile all the amazing different opportunities that are available within Luton and surrounding areas. Roald Dahl Museum isn't too far from here. They have the AIM Literary Festival at the moment, and on Sunday, the 5th of October, there will be an opportunity to get involved there. If you are thinking of becoming an author, that's at the Roald Dahl Museum for their AIM Literary Festival. And so today, coming back to Sandra then. Sandra, tell us a bit about Healthwatch Luton, please, and how this whole initiative began.
Right. So Healthwatch Luton was established in Healthwatch Luton was established under the Health and Social Care Act of 2012 to understand the needs and experience and concerns people may have who have accessed health and social care services. But before I continue, I need to give you a bit of background why it's important to capture the voices of the community and individuals who access health and social care services. I'm going to go back to a certain report, and it's the Francis Report, or formerly known as the Report of Mid Staffordshire NHS Foundation Trust, public inquiry. So this was chaired by a gentleman called Sir Robert Francis QC, who was a barrister. And in response to the alarming poor care standards at this hospital and high death rates, and the numerous complaints from patients and their families between 2005 and 2009. So clearly the patient voice was not heard. And within this report, there were key findings, and some of which was widespread neglect of patients. There was poor hygiene and inadequate staffing of nurse care. There was also systemic failures, which meant that there was poor leadership in the hospital, and that it was discovered that financial targets was placed above patient safety. The patient's voice, again, was not heard. The patient experience and the patient's families highlighted during 2005 to 2009 the appalling conditions, such as a patient being left in soiled bed sheets. And from the findings and recommendations from Robert Francis QC, there was over 290 recommendations, one of which was about transparency, openness, and candor that needed to be adopted throughout the healthcare system. And this findings was that he said that there should be improved support for compassionate, caring, and committed care and stronger healthcare leadership. He recommended a patient-centered care. So the Francis Inquiry started on the 8th of November 2010 and was published on the 6th of February 2013. So again, the reason why I'm giving you background was because there were so many failings that 290 recommendations needed to take place in order to help the experience, the patient experience, and that of their families, and also care for the very staff that were looking after the patients. So then that's where Healthwatch was established under the Health and Social Care Act 2012. As I said before, it was to understand the needs and experience and concerns people had who access health and social care services. So we are Healthwatch Luton. We engage with all parts of Luton's diverse population to ensure a broad range of experiences and views are considered. So you would see us at events. We will be at health events. We will be giving out toothpaste and toothbrushes at schools. We would be, my goodness, we're all over Luton. We will be working with primary care network organisations, and we give out information, NHS information and diabetes information. And we also give out free leaflets and and freebies as well.
Sure. Yeah, it sounds like you're doing a lot of amazing amount of work on the back of a very tricky kind of a situation, which I mean, the figures speak for themselves, the high volume of recommendations needed to try and fix what sounded like a very broken system. And it sounds also like that you're offering this local voice to local people of Luton so that they are in a position to be able to influence the delivery and design of local services, which I think is highly commendable. And so, listeners, if you hadn't already heard of Healthwatch Luton, there you are now. Now you know who they are. Sandra's very kindly summed up the history of Healthwatch Luton, why it came into existence, and the kind of work that they are doing. The primary care networks, we've had some of those on our show in recent weeks and months, and they're an amazing group of organizations that are doing incredible amount of work. So, Sandra, once you go to different events, etc., do you have one particular base? Do you have an office where people will drop in for any support?
Right. So we are based at Futures House. We have a Healthwatch Luton form, and on the form it's got our telephone number, our email, and there's a QR code if you wish to access us. Because our work is, rooted in strong community connections and grounded in real life experience of people that we serve. Fortunately, we are independent, impartial, and confidential concerning people's feedback with their experiences. I tell you what, I have to do a big shout out to our staff, our four staff, and also a big shout out to our amazing, valued 9 volunteers that really help Healthwatch Luton reach the community to get feedback. So it's really wonderful because from the feedback, we are able to do reports, And for example, we there was a report that was done this year, and it says hands that speak, and it's exploring the lived experiences of deaf people, and that was led by, you know, my chief exec, Patricia Latimer. And if I can just give you just a brief outline of how important feedback and Healthwatch Luton getting involved in people's experiences. So it spoke about Jacob and Rosie, who were both deaf, and it speaks about their experiences and challenges with communication when accessing health and social care appointments. So this may include your doctors, your dentists, your opticians. And during the time of COVID, Jacob received his second vaccine. And when he had done so, he described complications with chest and leg pains. And what you find is that when Jacob and Rosie went to a doctor's appointment, there is a duty of care for doctors to provide a British Sign Language interpreter. If I just go to the conclusion of what happened to Jacob, he was admitted to hospital, and unfortunately he passed away because had they have been a interpreter there who could explain to the staff that, look, you know, this is what was going on with him, possibly his life could have been extended. You know, so it's important that you know, people are aware that that there is a translation and interpretation service. And in 2024, Healthwatch Luton carried out a survey of translation and interpretation services on behalf of the Integrated Care Board. And the findings show that while most general practitioners, GPs, were aware of the services available, primary care providers such as opticians and pharmacists, awareness was lower. So when I speak about Healthwatch doing reports, a report was done on what I've just said.
And I think it's crucial to be able to hear those voices of individuals, in our case, residents of Luton and surrounding areas, accessing health services. Then that does contribute towards the bigger, wider national Healthwatch project as well, which your feedback, I think, gets a contribution towards, so people are able to understand how services are offered in Luton compared to other parts of the country, and it is all through that feedback. And what you do is absolutely amazing. You know, understanding the needs, experiences, and concerns of people who use health and social care services, and giving them the reassurance that they do have an opportunity to speak out, and you would be able to speak out on their behalf as well. And I think it's also very, very encouraging to know that Healthwatch are here to listen to what people need to say about services and what they think needs to be improved. Some of the case studies you referred to, Sandra, they are quite powerful, but unfortunately, those kind of situations still occur. We know that. If you go back to somebody perhaps needing a BSL interpreter, for example, you know, we'd expect that to be a necessity that ought to be met Unfortunately, sometimes that doesn't happen, and we know there could be vital element of health that could be at risk simply because the need has not been understood by the very professionals who are appointed to be able to provide that support. So, absolutely, I think it's vital for people to be able to realize that these are the kind of supports that they could request when they find themselves in that kind of situation. You mentioned your some of your teammates earlier, people that work alongside you. You have a very small team of individuals. Then you got board, and then you have staff team and some champions. How do those three different roles work? So you got some people who are Healthwatch Luton board of directors, and others are staff, and then you have champions within that.
I think the quality would be empathetic, a good listener,
Mm,
interested in care. Um, and if they are interested, they can contact us on www.healthwatchluton.co.uk,
mhm,
and we will take it from there. So, but as I said, we do value the amount of work that the staff and the volunteers put in to make Healthwatch successful. But we can't do it without the public. So I
mm,
believe that we are champions.
mm,
We're
mm.
champions for health and social care causes. Now,
Absolutely, and I think, sorry, Sandra, just to following on from that, listeners, if you are thinking, you know what, hey, I've got some skills that I want to be able to dedicate towards volunteering with Healthwatch Luton, you can go on the website. It's just www.healthwatchluton.co.uk, and then there's a third from the left tab called Get Involved. If you click on that, and then underneath it, it tells you a bit about becoming a Healthwatch Luton volunteer. And then there are some frequently asked questions. And at the bottom is so you've got the volunteer registration form. Just click down on that. It's a simple, straightforward form. Complete that, submit it, and you would then be able to hear back from Healthwatch Luton, and they'd be able to get you involved in some capacity. I think the whole idea is to try and get as many people from a whole host of backgrounds as possible involved, and to be able to better resonate with different community members within Luton and surrounding areas. So that I think is in itself quite commendable. And then there's an opportunity for people to share the experiences. I know you touched on this already, Sandra. So if somebody wanted to have a say or share their experience with you, how would they go about that?
right. I so there is again, you can visit our website on www.healthwatchluton.co.uk, and also the reports that we've done over the years, over the year, can be accessed through www.healthwatchluton.co.uk stroke reports. So you'll know all the reports that we've done. And we work in collaboration with organisations, with the Integrated Care Board, with, as you know, Primary Care Network and the Luton Borough Council. And I know that in September, the 13th of September 2023, the Denny Review was published, and Healthwatch Luton covered the area of the LGBT and people, and their findings is that many felt that the respondents felt that they did not have enough time with GPs face to face, and they were not able to discuss issues as they wished to. And some respondents had completely stopped engaging with healthcare services as for due to the lack of cultural competency. So this is just an area just highlighting that if we are not out there finding out what people are experiences, we cannot report it, and we cannot help change to come forward. We also this year had a report on period poverty, and our CEO Patricia Lattimore was in collaboration with Luton Sixth Form College students and staff, and so it's so good. So again, if you want to access this, please read our report. Now, one of the things that we hear when we go out is that people say about getting a GP appointment because not everybody is digitally competent. And we also did a report on that. And the report was a report on how easy is it to access GP care in Luton. So what we had was a card that when we went out to various events across Luton, one card was concerning mental health, GP access, dentistry. Did I say mental health? Not too sure.
You have now.
Yeah.
Sorry, Sandra, I'll come in there and just to remind our listeners that you are listening to the Sunday the Community Show with me, Hafiz Muhammad Umar. And in today's show, I have Sandra Gouldbourne with me. And Sandra is the Community Engagement Officer at Healthwatch Luton. And we are talking about the different types of services and that Healthwatch Luton provide. And particularly, Sandra is going over some of the recent published reports. And that was the direct result of the hard work of Healthwatch Luton. And if you want to be reading these reports in length, they can all be downloaded fully from www.healthwatchluton.co.uk/reports, or if you just go to Healthwatch Luton, and it's the second last tab entitled Documents, and move down one sub-tab to Reports, and they are all there. Some published as recently as last week, the Very of Voice Autoimmune System Case Study, published on the 25th of September 2025. This case study tells you the story of a person called Tina, a Luton resident living with two autoimmune conditions, type 1 diabetes and rheumatoid arthritis, and her experiences of health and social care services. So what Sandra is talking about there is something that's very current, is very much out there, that a lot of our local residents in and around Luton can resonate with. And hopefully, when you look at some of these reports, you think, actually, this is what I've been through. Perhaps, I'd like other people to be able to hear my story, and in which case you can contact Healthwatch Luton. The other report was published a week earlier, access to GP care in Luton. And again, your views. This was published on the 22nd of September 2025, again, just over a week ago. So this is one of the reasons why we've asked Sandra to come onto the show and talk about their excellent service, because we want people to know more about the hard work Healthwatch Luton are doing, and for the community to realise that it's there for them to be able to get involved in as well. It's not like it belongs to other. There is no other service that belongs to all of us. So, Sandra, I'm going to be asking you to tell us a little bit about the information advice. We are going into the final couple of minutes of this first half of the show. So, the information advice, what kind of information advice do you offer at
Right. So, yes, thank you. So what I will say is, if you could just play that little video, because that will just encapsulate what I want to say, and then I will add my thoughts.
Okay, brilliant. So there are two short videos that we are going to be now playing about Healthwatch Luton, and they are just under 2 minutes long in total, and they do pretty much summarize the work of Healthwatch Luton. Here's the first one.
We are Healthwatch, and we're here to help make health and social care better for you. Have you recently been to your GP, visited a pharmacy, stayed in hospital, or used any NHS or social care service in England? Your experience matters to us, and we want to hear about it. Your feedback has the power to drive change and build better services. By sharing your story, you help us work with NHS leaders to get people the care they need. We're also here to guide you to the right support and services. If you're feeling lost or unsure about what options are available, we can help. Wherever you are in England, your local Healthwatch is ready to listen and support you. Together, we can make health and social care work better for everyone.
So, listeners, that's the end of the first half of the show. We're going to a break now. When we come back, we will continue with Sandra. Wassalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah. Amma ba'd, assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the second half of tonight's Sunday in the Community show with me, Hafiz Muhammad Umar. And if you were with us before the break, you will know that today I am delighted to be joined by Sandra Gouldbourne. Sandra is the Community Engagement Officer at Healthwatch Luton. Welcome back, Sandra.
Welcome again. Thank you for having me on your show. It's a pleasure to be here. Thank you.
Brilliant. So, listeners, before the break, we were talking about Healthwatch Luton. Sandra very kindly summarized the history of Healthwatch Luton. We talked a bit about the excellent work they are doing. Really, in a nutshell, they're out there to be a voice for the local residents when it comes to accessing health and well-being in and around Luton. We touch very, very briefly on well-being. We will discuss that in more detail during the second half of the show. And also opportunities for people to get involved through volunteering, giving their time back to the community, sharing their own experiences, positive and otherwise, so other people can learn, whether it's the professionals that you are seeing for your health purposes or whether it's fellow patients. If you've accessed a particular service that's worked well for you, please let other people know. And if, on the other hand, it hasn't been a great experience for you, again, don't keep it to yourself. Please share so that lessons can be learned and another person can actually perhaps be supporting them better way than you might have been. So all of that can be facilitated through Healthwatch Luton, but they do a lot more than that. We've been talking about Healthwatch Luton in particular, but we know it's part of the broader Healthwatch family through Healthwatch England. So Sandra, tell us a bit about Healthwatch England then, please.
Right. So we exist on a national, Healthwatch exists on a national and a local level, and working towards the same goal of enabling people to have a voice about their health and social care systems. So Healthwatch England is a statutory committee of the independent regulator CQC, which is Care Quality Commission, and they have statutory functions which are to provide leadership to local health watches, guidance, support, and advice to the organisations, and also to escalate concerns about health and social care services, which may have been raised at a local level, and they would feed back to, as I said, CQC, and this helps the views that are shared by the public. Those views will go to commissioning and scrutiny of care services. So we're all connected. Within Bedfordshire, there are another two local health watches, which is Bedford and also Central Bedfordshire. So we work do different areas, but we all reach people concerning their health and social care experiences. We also, Healthwatch Luton also sits on focus groups. So we're on mental health, concerning mental health, concerning young people, concerning diabetes, concerning LGBT people and trans. So it is very, we reach all communities. We try and reach all diversity of the population within Luton. So
thank you. And if you do need to get in touch with Healthwatch Luton listeners, you can call them on 01582 817 060. That's Healthwatch Luton on 01582 817 060, or you can email them on info@healthwatchluton.co.uk. That's info@healthwatchluton.co.uk. And on the website, if you go to www.healthwatchluton.co.uk and you go to section under the home tab, there's a lot more information there. And at the bottom, there is a form that signposts you towards them, and then you can learn a lot more about the whole team, the kind of work they do. All the reports that Sandra and I discussed in the first half of the show are all easily accessible there as well. Um, Another thing we were just touching base on before we went into the break was around information and advice available through Healthwatch UK. So there is support over the winter that's available. We know winter isn't too far, although this week appears to be largely mild in terms of the weather. We know it will change very, very quickly. Um, and I'm going to ask Sandra to tell us a bit about the winter support available through Healthwatch Luton.
okay, so thank you. Can I just add, there's 153 local health watches across the UK.
Wow.
Right. So stay well in winter is one of the leaflets that we do give out when we are out and about. And also, so stay well for winter will be information such as, keeping hydrated, keeping warm. Across Luton, there are what they call welcome spaces that will be set up and already have been set up. Another term is friendship spaces, where you can have a cup of tea, a cake, a jacket potato, and this is across Luton. Faith communities open their doors, and just community centres. Now, we encourage people to access their local pharmacy. So instead of just thinking about, I need to make a GP appointment, depending on obviously the condition. If it's things like sinusitis, 12 years and over, sore throats, 5 years and over, ear infection for children 1 to 17 years, infected insect bites, 1 and over years, shingles, urinary tract infection for women aged 16 to 64, you are able to speak to your local pharmacist. And it is, what does Pharmacy First provide? So I've just given you just a few lists of what they do. And yes, and we also encourage people to get in contact with 111. And if you need to make an appointment or arrange to be seen at a local NHS service such as your GP, out of hours GP, extended access service, urgent treatment service, then you can call 111. And interestingly enough, general practitioners, GPs, surgeries allocate just a few appointments to 111. So sometimes you're not able to get an appointment with your GP. You might be able to get an appointment with a GP that is within Luton, because there's an allocation of GP appointments. I don't know how much, so I can't say, but it's just something that one can consider.
Thank you, Sandra. I think if I just go back to what Sandra was saying there around the support available through your pharmacies, there are additional services that are provided by them, which we may or may not always pay attention to realize. A lot of us might go in there, just see them dispense NHS prescriptions. They can also have access to the repeat prescription service. They could provide an emergency supply of medicine, subject to the decision of the pharmacist. So if you run out of your medication, which you have been prescribed by your GP and GP service is closed, you don't necessarily need to be worrying if it's a case of emergency. Speak to your pharmacist. Non-prescription medicines like paracetamol are available over the counter from pharmacies. Usually there is a limit on how many you can buy, quite rightly so, but that they are available. And they can also dispose of unwanted or out-of-date medicines. So if you got, some medicine lying around for months or years in a kitchen cupboard somewhere at home, you're thinking, what on earth do I do with this? Actually, just take it down to your local pharmacy and they'll be able to dispose of it lawfully and without you having to just worry about not knowing what to do with it. So there's some of the things that they could support with. We were talking about the winter support through the Healthwatch Luton and the primary care services. They do have an out of hours support. Again, you can access that through the Healthwatch Luton website. Pharmacy support we just talked about. Staying well then, Sandra. Luton Council wants to do a lot for everybody, particularly the most vulnerable, and especially during the winter. Is there anything being planned, any events by Healthwatch Luton, or are you going to be in attendance with any at all?
Right. So tomorrow there is an event on celebrating I think it's Older Person International Day, and that's going to be at Lucy Community Centre.
Sorry, Sandra, just to pause there. This is a pre-recorded show. We are recording this on 30th of September 2025 to be played on 1st of October 2025.
Oh, okay.
So I think by the time this show is played on radio, that event might have passed already. So
Okay.
it's really Thursday, the 2nd of September, October onwards. So I'm glad I mentioned Thursday, the 2nd of October, because if our listeners were tuning in last week, they would know that we've got the Hatters Primary Care Network together with medics are organising an event at the Hopple Community Centre on Thursday, the 2nd of October from 5 to 7 p.m., particularly for people with disabilities. So if anybody is able to attend, that will be on Thursday, the 2nd of October 2025 at Hopple Community Centre from 5 to 7 in the evening. So sorry to cut him there because it's a pre-recorded show. Listeners,
No.
Sandra and I are meeting in advance, and we sometimes forget to what events are happening when. So yeah.
Well, thank you so much, because that was my next event that I was going to share with you, and just to say, the patient's charter comes out from the 1st of October. And I think on Healthwatch Luton's website, there is a commentary on how can you help your general practice, which is quite interesting. And I know it's things that when we go for appointments, we don't really think about. But if I just give you a few tips, is that all right?
Yeah, sure.
So it's firstly, be prepared before you go to the appointment. Think about your symptoms. Write down exactly what you want to say to your doctor. Number 2 is to be available for a call back if necessary, because I know sometimes it's not possible, but also be on time for your appointment. If you need to cancel your appointment, please do so, because that can go on to somebody else's. You can use the NHS app and website to make appointments. You should turn on your notifications, and ordering of your prescriptions, as you previously mentioned, Mohammed. And you're able to join the patient participation group, which I know some of our volunteers are part of in their surgery. And it's just to really get involved. Healthwatch Luton and Healthwatch in general, we do actually have statutory powers, so I digress. We do things what we call interim view, whereby we are able to go, for example, on the maternity ward to gain feedback through a questionnaire, question and answer, or to patient, their families, and also staff. So that is another way we receive our information. And we also had postcards with 4 questions or so concerning accessing healthcare services, primary services such as your optician, dentist, and doctor, your GP.
Okay, brilliant.
So,
thank you so much for that, Sandra. I'm going to be playing another short video now that talks about how Healthwatch can help you find health advice and information.
Excellent, thank you.
Navigating the world of health and social care services can be a daunting and confusing experience, especially when accessing NHS services. It can be overwhelming to make important health and social care decisions. But Healthwatch is here for you. With over 150 local Healthwatch in every part of England, we can help you get the advice and information you need. We aim to help you make informed decisions about your care needs. Whether you want to know what support you can get from your pharmacy or understand how to make a complaint, Healthwatch can help. Or if you need more support, Healthwatch can point you in the right direction. When you need advice and information, you are not alone. We are here for you.
So that was a short video about what Healthwatch actually stands for and the kind of support they could provide. We will now go back to what we were saying earlier. And before I do that, I think Sandra wants to come in and add something more. Sandra?
No, I just wanted to just again thank you for having me. And I hope it's been beneficial to someone out there, even to say that we are champions of your voice, the voice of the community, the voice of the town of Luton. So we welcome feedback.
Yeah, brilliant. We will, of course, continue to encourage our listeners to provide that feedback to Healthwatch Luton. Sandra, are you going to be able to stay with us for the rest of the show? Do you need to go now?
Right. So I think, yes, yeah, I need to wind it up now. I hope
Okay,
that's okay.
you've done your bit. Sandra, thank you so much for joining us for today. Your time is highly appreciated. Listeners, that was Sandra Gouldbourne from Healthwatch Luton, and we very much value your time, and we wish you and Healthwatch Luton all the best for the future. Thank you so much for coming on.
You are most welcome. Thank you for having me. Bye-bye.
So that was Sandra Gouldbourne from Healthwatch Luton, telling us about the excellent work Healthwatch Luton are doing in Luton and surrounding areas, and also nationally, the work of Healthwatch England. Healthwatch Luton had the annual general meeting on Tuesday, the 30th of September, in Luton, and there was an annual report for 2024-2025 distributed, entitled Unlocking the Power of People-Driven Care. And within that, they focused on their year in numbers, this last year, 2024-2025. And they've done an amazing amount of work. They've supported more than 4,000 people to have this say and get information about their care. They currently employ 4 staff, and their work is supported by 8 volunteers. In terms of their reach out work, 3,525 people share their experience of health and social care services with Healthwatch Luton, helping to raise awareness of issues and improve care. 275 people came to them for clear advice and information on topics such as mental health, support, and finding an NHS dentist. In terms of championing people's voice, they published 14 reports on the improvements people want to see in areas such as mental health awareness and services, maternity services, and local community outreach. Their most read report was entitled Your Voice Counts, St. Thomas Gypsy and Traveller Community, which highlighted the challenges faced by the local Gypsy and Traveller community in accessing healthcare. And in terms of the statutory funding, they're funded by Luton Borough Council, and in 2024-25, they received £122,000. This remains the same as funding given in 2023-2024. So that is something that Healthwatch Luton wanted to be shared with the local community. We know they are facing an uphill task at the moment with this possible threat of the national government perhaps not recognizing or not really realizing the excellent work Healthwatch Luton are doing. And if you are somebody who has benefited from Healthwatch Luton services or are inspired by the amount they are doing, please look out for a petition that's been sent out at the moment to convince our ministers to enable Healthwatch Luton to continue to receive the funding, so that they are able to carry on this amazing amount of work they are doing in Luton and surrounding areas to support some of the most vulnerable people within our communities. And to that effect, I will now look at additional kind of information advice they offer. And they do a lot for women's health, and there is still information available on the website regarding coronavirus, dental care, mental health support. There is a complaints information going through protocols, procedures about raising complaint if you have one, cost of living support, NHS acronyms if you're struggling to keep up with them. How should social care support you? And there are topic videos available, interpretation services. Sandra mentioned earlier about something perhaps as simple as getting a BSL interpreter for those who are deaf or for our deaf community when accessing health services. That should not be um, difficult. It should be a reasonable adjustment that should be made. Um, there is also a section on useful organizations, easy to read information. Again, very, very important for people to be able to understand that this is their right, and they should be able to have that in easy to read, starting with Watch is own easy to read PDF directly downloadable from their website, which simplifies in plain simplified English who they are and what they do. Um, and that is directly downloadable. It just takes a couple of clicks to do that. And then accessibility as well. So that is something that is also very clearly covered. An additional thing on easy to read is it starts with you, transcript, easy read document, and again, I would encourage our listeners to visit the Healthwatch Luton webpage and please benefit from their services. We are coming to the end of the show now. My thanks again to Sandra Gouldbourne, the Community Outreach Engagement Officer at Healthwatch Luton, for joining me today, and her team who are working tirelessly and behind the scenes to ensure that everybody is supported in our town. And do join us again next week, inshallah, for another Great Sin in the Community show. Wassalamu alaikum wa rahmatullah.